So hello everyone, my name is Yuritza Escalante, and I worked on this project alongside graduate student researcher Jing Wang and Professor Misaki Natsuaki, and we looked into observing the effect of self-care on loneliness in college students with looking at extroversion as a moderator. So a major shift that occurred during the pandemic is time spent alone. So because more people had this time to themselves, this can inflict feelings of loneliness. So we were curious to see feelings of loneliness. So loneliness is described as a feeling that arises whenever a person's actual relationships do not align with their desired relationships. And then also with loneliness, a study found that individuals aged 18 to 22 years old did report higher levels of loneliness across age groups. So this inspired us to look into college students, which falls within this age group. And then we wanted to look into ways to mitigate this loneliness through self-care practices. So self-care is defined as the intentional attempt to care for one's individual needs. And past research shows that self-care is effective in reducing negative outcomes and enhancing positive outcomes. Additionally, we wanted to look into the personality trait extroversion to see whether this is an important moderator of the self-care practices. So past research has found that introverts were able to experience much more emotional benefits when they were exposed to mindfulness-based cognitive therapy in comparison to those lower on extroversion. So because of this past study, we hypothesized that self-care is going to be an effective method in mitigating loneliness, but especially for those lower on extroversion. And so the way that we did this is we recruited 86 college students and that had a mean age of about 19 years old. And the majority of them came from an Asian or Hispanic or Latino ethnic background. We had them complete a series of surveys that measured on extroversion, loneliness, and self-care with their respective scale. And we first looked into correlations to see whether there was something occurring with these variables. And we found that participants that were more extroverted did report lower levels of loneliness. And then also people that engaged in more self-care were also less lonely. And participants that were more extroverted also engaged in more self-care, but these are simply correlations. But to look into the question that I was interested in examining, we conducted a linear regression in which we first looked into the main effects of self-care and extroversion individually on loneliness. So we did find that this main effect it does occur with both of these variables having a negative association with loneliness. And then we looked into the interaction between extroversion and self-care. And what we found was that individuals that were lower on extroversion, as seen by this top line, the individuals lower on extroversion, when they engaged in more self-care, they were able to experience a stronger, more of a decrease in loneliness compared to individuals that are higher on extroversion. Individuals higher on extroversion did still experience that decrease in loneliness, just not as strongly as individuals lower on extroversion. And then, yeah, so we could see that that the slope of those lines vary in strength. So because of this, we can conclude that self-care is effective in mitigating loneliness overall, but however, overall, and then also we did find that individuals that are lower on extroversion are more at risk of feeling lonely. But however, we did find that self-care is effective in mitigating or in mitigating levels of loneliness, especially for those lower on extroversion. So what we suspect from this is that maybe because of the context that self-care is usually engaged in, since it's more practiced within a private space, maybe this is more fit for people lower on extroversion to extract more benefits from the practices. A couple of limitations is that we did have a small sample size. And then in addition, we weren't able to examine specific categories within self-care, which would have been something to look at to see whether maybe there were particular types of self-care practices that were more effective than others. So that is something for future directions that we would want future research to look into a more self-care measure that can be broken down into categories to see which ones are more effective. And maybe there's some that are more effective for certain personality types than others. But just based off of these results, future interventions should, so advocacy for self-care practices should kind of focus on people lower on extraversion, since these are the people that are showing to be able to extract the most emotion enhancing benefits from these practices. So lastly, I would like to thank my faculty mentor, Dr. Misaki Natsuaki, and also the graduate student researcher that helped guide me throughout this project, as well as the Developmental Transitions Lab for supporting me throughout this project, and the Chancellor's Research Fellowship as well. So I'm now open to any questions. Yeah.
So you did say that there is a possible reason why people with low extraversion benefit more than those with high extraversion because they practice self-care more than intimacy.
Yeah.
My question is, self-care is not only limited to being in a confinement. It doesn't, I guess, facial for example, like going to the movies alone could be considered a self-care, or going to the beach alone. Now with extraversion, there are some people who are extroverted, but they are more around more people pleasing, so they surround their happiness around having other people around them.
Yeah.
So in that circumstances, that could be a reason why people with extroversion do not really benefit a lot compared with the extroversion, because most of the self-care stuff does not revolve around them and others. It's more around just themselves.
Yeah, I definitely agree. That's also something that I think would be great for future research to look into, in having those different forms of self-care practices. Not only that the self-care practices vary, but also the different contexts. So as you were explaining, those higher on extroversion, I imagine would experience more emotion-enhancing benefits from being maybe in a more social environment in comparison to those lower on extroversion, can experience more emotion-enhancing effects probably in that own in a private space of being able to care for their own needs, maybe in a more intimate sense. Yeah.
Did you define self-care for the participants, or did you leave it open to their interpretation?
Yeah, so the way that self-care was measured within the survey, so we conducted, so they filled out a survey that measured for self-care, and the way that I particularly chose this measure is I wanted to find a measure that addresses when a person attends to their emotional needs. So some examples of questions that were on the scale was, it asked how much these participants cared for their own basic needs. So how much they engaged in, I engage in physical activity. So they were essentially presented statements, and then they said how much they agree with those statements. So one was, I engage in physical activity, attending to their basic needs. And then it also measured for how much these people seek social support. So I know how to seek out a colleague whenever I need the support. I know how to ask for help. And also boundary setting. So I know when to say no. I know when it's appropriate to step away from a situation. So in this study in particular, that's how self-care was measured. And yeah, so I chose a measure that more paid attention to satisfying those emotional needs. Yes.
How did you define your participants? Like, how did you know this person is an extrovert, this person is an introvert? Was this included in your survey?
Yeah, so that's one of the other measures that I had them filled out. So they did complete the Big Five inventory, which measures them on extroversion, openness, conscientiousness, agreeableness, and neuroticism. And so we used the extroversion scale from this short form to figure out how where people lie on that scale of extroversion.
You didn't use any of the other Big Five things?
So not for this project, but we just we had them fill out that measure to get this, to look into this question. Yes.
Were you able to measure these participants' actual frequency of social interaction?
Yeah, so I think because the self-care measurement that I used didn't really have that focus on engaging in social interaction, I unfortunately was not able to look into that, but I do think that that would be interesting to look into, and also kind of looking into the definitions of what that individual defines as being self-care for them, I think would have a big effect as well. But yeah, I wasn't able to look into that in this with my data. Oh, yes. Go
And
ahead.
then maybe if you could, if you were going to categorize in like broad terms, different types of self-care that that you could dig into deeper in future study, did you guys think of how you might probably categorize these different types of self-care, or like maybe, I don't know, compare it to like a biopsychosocial model, like
Yeah.
health-wise, like self-care as it pertains to, you know, physicality, sociality, mental health, or anything along those lines?
Yeah, essentially exactly what you explained. I feel like so self-care practices are divided commonly within psychology literature. So there are self-care practices that are more fall into caring for one's physical needs. I believe another one is also occupational, also social needs, intellectual needs, and emotional needs. So there is ways to divide those self-care practices to be within certain categories. But again, yeah, I think it would be interesting to look into whether the different categorizations of self-care practices would have different effects for different groups of people.